Awesome. Good afternoon, everyone. It's great to see you. My name is Greg Morris. I'm the CEO of the New York City Employment and Training Coalition. I'm really excited and grateful to have this opportunity to be present with you on a cold winter's day outside. I'm hoping that we feel some warmth here as we talk about the work that we do and how we do it, and the opportunities that exist to take on and pursue innovative opportunities for growth and development of the professional community we are part of. Because while we are dug in on the day-to-day trying to make the right pathways for New Yorkers, there's nothing more important than elevating the professionals who do this work and do this work with impact and success so that we all succeed together. On that particular note, let's start with some introductions. Stephanie, why don't you start us off?
Hey, I'm Stephanie Birmingham, she, her pronouns. I'm the Director of Community and Operations at NYCETC. Thanks for being here.
And Door team, it's great to have you. Kelsey, why don't you lead it off and you can introduce your folks.
Sure. Hi, everybody. I'm Kelsey Louie. I use he, him, his pronouns. I am the CEO of the Door and our charter high school, Broome Street Academy. And I'll pass it off to Gabby.
Hi, everyone. Gabriella Esposito, or Gabby from the Door and Broome Street Academy. I'm the Vice President of Policy and Strategy. And I see Mika on as well.
Hi, everybody. I am Mika DeRue, she, her, hers pronouns, and I'm the Managing Director of Communications and Marketing here at the Door.
Welcome. It's so this is that we're going to spend some time having a conversation here. And before we dig in, those of you attending, I know you're off. Many folks are off screen. I hope you're listening. I hope you're and this is also being recorded. So if you lose the opportunity to listen to the whole session, we hope you check in. We also hope that folks, when we get this out to our New York City Employment and Training membership, that folks check in and experience this particular recording. We are going to have a conversation and then we'll switch over to Q&A. Please know, though, if you're on, you can put questions in the chat at any time. We'll do what we can do to weave them in as we go as well. So feel free to plug in your questions as they come up, but we'll also have set aside time to take questions too, if that makes sense. Before we jump in, I have to admit to you, I'm a Door guy. I spent a considerable part of my career. I grew up a little bit as a professional at the Door, and there is no place like it. And I mean that. And I think anyone who's been part of the Door universe probably says pretty much the same thing. And I think that's true about the professionals and the folks, the clients, the participants, the Door community members, the individuals who are touched by the Door and all the different ways that that is possible. Just before we jump into creating this pathway to social work degrees, Kelsey, do you want to talk about what the Door is? How does it work? How do you describe it to folks so that everybody on the call is aware of where we're starting from?
Sure. Well, first of all, Greg, thank you for everything that you've done at the Door. And, I mean, we are who we are today because of folks like you. And once a Door member or staff person, always a Door member or staff person. So the Door is a youth development organization. We serve young people ages 12 to 24. Started in 1972. We see about 10,000 people each year. And we do so through a variety of programs. We have everything from workforce development, career and education services. We are a federally qualified health center. We have arts programming, runaway and homeless youth services, 2 buildings of supportive housing, and legal services, mental health services, substance use services, basically anything a young person needs in order to thrive or survive, we offer, including a charter high school. And so really excited to be having this conversation. And when we talk about our services, we focus on a few things. One, it's comprehensiveness, not just overall, but within each service type. Accessibility, and this leads to kind of what we're going to talk about today in terms of accessing further education for staff, and making sure that we do what we can to listen to our young people. And those are kind of our 3 ingredients for success.
That's awesome. Thank you for teeing that up. And just as a reminder, if you have questions, feel free to plug them in the chat. You feel free to introduce yourself as well. We want to create networks. Part of the job of the New York City Employment and Training Coalition besides focusing on policy and advocacy in support of workforce development, is also to create networks, build connections, be the glue that brings employers, providers, higher ed philanthropy together. And I think our job as well, in addition to connecting with employers and policy and advocacy and making connections and running conferences and legislative briefings, is to highlight innovation and to be able to talk about how it is that we are seeking, our membership is seeking to create value and impact. And we do that in lots of different places. So I'm really thrilled to highlight the Door and the Door's work as a starting point in this particular set of conversations that I know we will continue as time goes on. One additional thing before we really dig in, I should say, Kelsey, you want to say a little bit about your background? How long has it been at the Door, and where were you before that?
Sure. It's been about 3.5 years as the CEO of the Door. Prior to this, I spent 7 years as the CEO of Gay Men's Health Crisis. Prior to that, about 7 years in another HIV organization, Harlem United. But prior to that, I spent a good amount of time in child welfare, worked at New York Foundling. I was a child's therapist. I am a social worker by trade. I have my MBA, but I identify first and primarily as a social worker.
I appreciate you sharing that and telling us a little bit about that. I am not a social worker by training. I've my first experience actually with, I think, social work, case management, and I think the intensity of mental health services that communities need access to was my time when I was engaged at the Door, and I got to meet a really remarkable set of counselors, therapists. That's where I got introduced to art therapy. I never had seen that before, and I was observing that in real time. And there are all the different ways in which that the Door engaged with clients to think about how it is that they could find meaningful pathways. But it was my exposure to what that community is and how much respect and appreciation I have for the social work community. As someone who has a background in public administration, I always represent with thought and care about this particular community. So let's pivot to the conversation at hand here and why it is the primary driver of this particular conversation. So, and I will just acknowledge one thing before I pass it to you, Kelsey, and that is to say, as my career evolved over the course of being someone who started as signing kids up for summer youth employment, to being a program coordinator, to a supervisor, to a manager on a number of levels, I realized I was very lucky to be able to get training and credentials to be able to secure my master's degree in public administration. And as that sort of pathway, that sort of laddering up got to happen for me in all the ways, I really feel entirely blessed for all the reasons I was to be able to find those particular opportunities and pathways. One of the things I realized as a manager and as a leader is how little time sometimes we spend ensuring that the people who are in the midst of doing the work on a daily basis have true and clear and are resourced for professional development pipelines of growth and opportunity. And I think that's kind of how I want to pivot this particular conversation, Kelsey, to you, to tell us about the Door's partnership with NY Silver School of Social Work. What is it? What's happened thus far? And what has all the good stuff that's come to light? Can you tell us a little bit about this program model and maybe too where it came from?
Yeah, sure. So thank you. And thank you for this opportunity to highlight this work. Really, really great for everything that you do for the community. So thank you. So yeah, so really excited to be talking about this program. So it is an MSW program for Door staff. And but let me just give you some background in terms of how it started and why. So first, I'm convinced that we do not know the full impact of COVID and the new attention on race-based violence, both directly and indirectly, on our young people, on everybody, but in particular, on the mental health of our young people. I don't think that we've seen it all yet. And so we know that we are facing a mental health crisis. What people have talked about, I've kind of put a name to, which is what I'm calling the second mental health crisis, which is the lack of culturally responsive clinicians, especially since the pandemic. I think the pipeline was small before, but since then, I think many clinicians have gone to private practice or left the field because it was just too hard. So understanding this need, I wanted to create a pathway to help people get their MSW degree. And if you think about it, for those of you who know, or if you don't know, an MSW, it can be upwards of $100,000 at a private institution. Also on top of that, a few years ago, the numbers are changing, but folks also had to do 2 years of an internship at 21 hours a week, often on top of their job. And so that alone made it either cost prohibitive or time prohibitive or both. And I wanted to find a way to break down those barriers. And so the other driver was similar to you. I had the good fortune of being able to pursue several master's degrees. But when I got my master's degrees, my MSW, I worked full time, and I did my internship on the weekends and in the evenings, and it was hard. And I often give advice. I teach at the NYU School of Social Work, and I often give advice that it's okay to hustle in the early part of your career, but I think nowadays that's kind of toxic advice. Like shouldn't one job be enough? Or shouldn't we have pathways to get educated? So between that and also watching my mother works at a law firm working with immigrants in Chinatown, and she does not have a master's degree, but she is doing social work. She's providing support to her clients. She is sometimes the only person that will listen to her clients. And wouldn't it be great if she had a pathway to get an MSW? So all these things combined led me to think of this idea was what would happen if we borrowed some things from the business sector? Businesses will pay for their junior associates to get their MBA. Often if, all they have to do is go to the 26th floor of their building and, every Wednesday night, and in 2 years, they'll have an MBA. So I thought about, could that happen for social workers? And so this partnership with the NYU School of Social Work breaks down those barriers. So one, with the support of philanthropic friends, we were able to pay for 14 of our staff to get MSWs. We do have them commit to $10,000 for the entire degree, just so that they have some skin in the game. And if they're a union member, the union will cover it. And also with the good fortune of our Broome Street Academy board gave out 3 scholarships. And so virtually nobody is actually making any payments. And then the door is allowing our staff to do their internships within their 35-hour work week. So they don't have to do it on top of that. In addition to that, we are working on all classes so far are online, and we're trying to make any additional classes to be in person at the door. And then we've also received some other funds to help with other expenses like books and stuff. And so really eliminating time, cost, barriers, allowing 14 staff members, and there are 14 staff members of the Door BSA who finished their first semester and they're already in their second semester. And at the end of this, they will have an MSW. We'll have 14 staff members with MSWs. So really excited about that.
I appreciate there's a lot there. So let's unpack it a little bit. I mean, I think the starting point of saying, one job should be enough. I think I don't want to lose that thread. So I appreciate that starting point. We should live in a world where I'm working my job, I make a wage, I may put in extra time, I may work twice as hard as some of my colleagues, but really that should sustain me, right? And I don't want to lose sight of acknowledging that particular thought, but as a starting point. So I appreciate you sharing that. I think this idea of how it is that you saw something and then said, let's make sure, because you didn't just have an idea to be able to put folks on this path, you seem to have been able to conceptualize, perhaps because of your experience and your background and all the different sort of insight that you gained through the course of your career and your career development, well, we also need to think about scholarships, and we also need to think about the cost of books and that internship piece, a huge, now as someone who has worked with social workers and been part of organizations that were connected to social workers, you know, the licensing is complicated, it's time consuming, it's layers, that you were able to blend the internship capacity into that work, then be able to say, well, we're going to make sure it's taken care of and it's paid for, or at the very least, you've got a minimum sort of cost associated. But then shout out to the 1199 folks who are connected to this particular conversation today, by the way, for their investment. I mean, this is a pretty remarkable sort of package you put forward. What was the reaction when you first suggested this? Did you have a significant sort of turnout? Did you have to see who were folks uneasy about this particular option first? Was everybody ready to pursue a degree like this?
Yeah, well, it's really interesting because I first had this idea years ago when I was at another organization, and I pitched it as a workforce development, like a way to upskill our staff. And 7 years ago, there are no bites because I don't think there was a focus on this work or an awareness that we really needed to support our workforce. And then when I framed it as a way to address the issue of a lack of culturally responsive social workers in the pipeline, that's when I framed it that way, it got more attention. And then kind of secondarily, this idea around how this is helping workforce. Although when we talk about it, both parts get equal play. Everywhere I've talked about it, when I first brought it up to the dean at the NYU Silver School of Social Work, he loved the idea. When I talk to funders, when I talk to staff, when I talk to anybody that I talk to, thinks that this is an amazing idea. And love it. Even social workers who already have their degree, they'll say, "I wish we had this in place when I was there." We had over 20 applicants internally. We had to kind of whittle it down. And I think also, but here's the thing too. I wonder if people still think this is unattainable. And those are the people we want to reach. Those people who once thought a master's degree was unattainable.
And a couple things there to sort of think about. I mean, first off, it is striking to me as my career has evolved and as you have experienced and shared during this conversation. I feel very lucky and blessed to have put myself in a position or to have sort of the privilege associated with the way I look and who I am and how I have been resourced over time to have found my way to feel as if I could attain, I could grow, I could find I could find the economic or financial pathways. I could find the time to be able to take on more. And it's a reminder that not everyone has that. And there are a lot of reasons for that. You talked, and there are a lot of reasons about it. I mean, again, systemically, institutionally, in many cases, there is a tamping down of opportunity, in particular for those, I think, who haven't had the same sense of exposure or connection or opportunity to think about pathways traditionally and historically. So I think it's really valuable that you said, let's put this on a path. And I think that there's something really important about how NYU reacted to this as well. And I guess I'm curious, why did they want to get invested in this now?
Yeah. NYU has been a great partner and really love this because it's also part of their goals and their mission to make an MSW more accessible. And I cannot imagine what it's like to run and operate a school, especially within a university system. But Dean Lindsay 100% believes in making the MSW degree as accessible as possible. And he and his team have been a great partner trying to find ways for us to make it even more accessible. In fact, they too have offered some financial assistance to the folks in this first cohort, and have tried to make this as cost effective as possible. But really, it is aligned with their mission as well.
Let's talk about cultural competency. Let's talk about, you sort of teed this up, this idea of clinicians in this space and the desire to ensure a diverse, culturally competent social work, mental health workforce that meets the needs, the unique needs, the significant needs. You've been talking a lot about mental health in a lot of different ways. You there's some great writing that you've done on that, op-eds and things like that in that particular topic. So I'm gonna sort of, if you're not familiar with Kelsey, get familiar with what the messaging he's putting out to the world and his career and what the Door is contributing. In particular, like, how do you think about, as an organizational lead, the sort of challenges of trying to address what does cultural competency mean, especially now? I mean, given everything that's sort of unfolded over the last few months, but obviously historically, institutionally, how do you think about cultural competence? How do you support that in addition to this pathway? How is that something you bring to the fore of your work?
Sure. I mean, that's a big topic and something that we need to absolutely continue to talk about and work on. So I see this in a variety of ways. I think about it in terms of competency, cultural competency. I think about it in terms of cultural humility. So first I'll say is I think it's important that organizations really think about their equity work and their DEI work. And it's not, I mean, I'm guessing everyone here on this call is fully aware that it's not just about a social media post. It's about true programs and services that really look at the lived experience of our people. And what that means is really thinking about, one, including their voices, including the voices of the people whose programs you hope to the programs whose lives you hope to impact. And that is DEI work. Regardless of what they look like, that is the inclusion part of DEI, right? Making sure that we listen to the people who are going to be receiving services. And then, looking at, this program is thinking about creating pathways for BIPOC and LGBTQ folks. So that's the particular focus. So really doing some, I say real work around opening doors, creating pathways, making opportunities that didn't exist before. And when I think about, so why not just have this be a regular program? Because BIPOC and LGBTQ young people have particular needs. And it is helpful when there's representation in staff. It is helpful for shared experiences. And it's helpful, especially given the federal administration and kind of where we're headed. It's really important to prioritize the needs of BIPOC and LGBTQ young people. But also here's something, and I'm about to engage in a research project, which I can talk about at another point, but would love to. But we all know from our experiences that many people drop out of mental health care for a variety of reasons. And I think we need to explore what those reasons are, because I think they are different for different people, especially BIPOC and LGBTQ folks. And one of those reasons I know from experience is the lack of culturally responsive providers. So for example, if a social worker, well-intentioned, culturally humble, really great, if they do or say something that makes an LGBTQ young person feel unsafe, unseen, or unheard, that person may very likely drop out of care and just not make the effort to go to the office to do mental health work because they don't feel 100% comfortable. And that is something we need to focus on. And that is what I'm hoping that this program can help solve for. Taking people with lived experience and who have already dedicated years in this field and help them develop a pathway for them to get their MSW.
It's interesting when you share the experience of individuals and how it is that one might communicate and or receive information, guidance that is not sensitive, is not respectful, is not something that isn't aligned with the competence that is required. To have observed that both from the perspective of having been present at the door, and again, the experience of working and meeting a young person who is part of the LGBTQ community and also is having a housing challenge and is also has history in foster care. And so you've got these intertwining complexities. The Door is not the only place in New York City that experiences that. It's just something that I remember being connected to. Or I have history at Children's Aid Society as well, and Goddard Riverside, and some other places and pockets in Manhattan, whether it's related to housing opportunities, whether it's related to homeless outreach, whether it was related to older adult services. The complexity of lives oftentimes requires guidance, care, and support that is, again, to the point of being inclusive, meaning wanting to hear from that individual, have that individual guide some of what's happening and happening next and what needs to happen, along with the competencies that are required to make sure that you're on the right path, is so critical. It's so essential. And yet, and I think you are aware of this, our organizations oftentimes are not resourced to be able to provide the depth of training, professional development, supports, coaching. Again, you can find great talent, but talent takes time to evolve sometimes too. And the different coaching and guidance and tools and credentials and all the different pathways that folks need to be able to grow over time is not necessarily easy to find access to. So on that note, I'll just say, how were you able to secure the resources to do this particular program? And how is it that you think about resourcing, and I'll call it professional development. What I really want to get at is what you've talked about, which is, let's talk about equity in a meaningful way. Let's talk about inclusivity in a meaningful way. Let's talk about competence in a meaningful way. You said a real way. How do you resource that as a leader? And how is it that we should be thinking about working towards trying to get that better resourced?
Yeah. I mean, so first of all, you have to have a philanthropic partner who is open to supporting this type of work. And also look, we all, for those of you who are in development or understand or kind of resource gathering, sometimes it's how you package and sell something. I don't think many funders are ready to fund and support a workforce development issue for staff. Many funders want their dollars to go towards direct services. And I think we need to, I think many times, just like the helping profession, we talk all the time about how we need to listen to the people impacted by our services. I think funders in general need to listen to the people who do the work to understand what we need funds for. So if you can find an innovative and thoughtful funding partner, that's key. And we had that. And so we were able to talk about holistically mental health needs for the Door. So the funding that we receive, some of it goes directly to support services. And then there are these other ideas around this MSW program. And, the way we did it was we pitched it as something with two goals. One was a way to support staff and create a pathway for staff, but ultimately to provide higher quality services and to address the mental health needs of young people. So it was kind of, we layered kind of the rationale for why this was important. We did talk about the fact that it was innovative. And I think we talked about kind of the impact. I think this can be a national model for how social work education is delivered going forward. And I think there are many things that we can learn from this in other fields, other disciplines. And so really when I packaged it as a way to address the mental health crisis, the second mental health crisis, and create a pathway for the Door to retain staff, they thought it was obviously they thought it was a great idea. We have enough funding for 2 cohorts. So we'll do this 2-year program and then another. And I've spoken about this on panels, and other funders have been interested in this. So I think it does require kind of a funder that is willing to hear you out and listen to the impact.
Yeah, and got to be a funder as well that I think appreciates an innovative strategy. It's someone who thinks about the growth of your professionals and the value and impact that has. As you have seen, I'm sure throughout the course of your career, as you highlighted, that's not always something that the philanthropic community is as receptive to. And I guess I would also offer, do you see a pathway that public dollars could be used for this particular purpose? And I guess I'm posing that sort of both from the perspective of, again, I think your lens on how do we support mental health challenges, the complexity of individuals' lives at this moment requires investment from the philanthropic space. But it requires public and private dollars to be able to find the right roads. And I'm curious what you would suggest about how public dollars could be used to address both the sort of cultural competency conversation, the individual inclusivity conversation, the accessibility conversation, but really at the end of the day, what do we really need to do to move the needle to put more New Yorkers in a better space?
Exactly. Yeah, no, that's a great question. You know, I often say that systemic problems require systemic solutions. And so this is a small program, a private funder and 14 staff members, but this has to go to scale. And one of the ways to go to scale is to get government involved. You know, and I think about, you know, I often think about, you know, sometimes when you think out of the box, you have to look in other people's boxes. In the HIV world, we used to always say that we had the data and we had the tools, and we just needed the political will to end the HIV epidemic. And by political will, that means the desire, strong enough desire to invest dollars and cents into this. So we absolutely, the next step is to show the efficacy of this program, talk about all the benefits to an organization, the benefits to the people, the benefits to the field, and convince government that they need to subsidize these programs. They need to support schools. They need to partner with public schools. Fine, you know, private schools and public schools operate differently, but how can government work with public schools to allocate some time and space for this, for students in this program like this? How can they subsidize education? You know, I think that's a whole other topic around the cost of education. But really, and then also thinking about policies around like you mentioned, the complications of getting a license after you graduate. It actually costs more money. You know, I teach at the School of Social Work at NYU, and, you know, I have students there who are trying to figure out how they can pay for their licensure after they graduate. You know, restrictions on internships. And I think there are ways that we could really look at the barriers in a real meaningful way. And this is how kind of this whole process unfolded. Because I believe that when there's a problem, you really need to spend a good amount of time living with the barriers. Because if you jump too quickly to solutions, you don't necessarily solve for everything. And maybe you're solving the wrong problem. And so I spent a lot of time thinking about what were the barriers, and really came to the conclusion that it was time and cost and the idea that you can actually get an MSW. But I think government absolutely has to play a role in the scalability of this.
I love the idea of living with the barriers to determine what the problem is, to be able to come up with comprehensive, thoughtful solutions. As we know, that takes political will. Tell me more. What does political will mean to you?
Yeah, that means politicians who get it, politicians who understand the problem and see the problem and want to address it. And this can happen at any, you know, local, state, or federal, but understanding that there is a problem that needs to be addressed, and trying new things, or looking at the data that says that an innovative idea that, in this case, you know, a private philanthropy supported, and looking at how we could use government funding to support this wholesale, or at least even just one more step. And I get it. There are a lot of competing priorities, but sitting down and taking the time to understand the layers and the different things that a solution like this, or a program like this, solves for. I mean, not just meeting the mental health needs of young people, not just creating a pathway for individuals, but really adding to the field this issue of not having enough culturally responsive clinicians. is critical.
To build off that for a second, I'll just add, it is, we need these competencies, we need these skill sets. I also want to bring it back to maybe the beginning. You were talking a little bit about how in other businesses, I think you flagged as well, you have an MBA, that in other business models, the idea of people working with and within the structure to be able to secure their additional credentials, degrees, et cetera, is part of what the business, how the business works and how the business can potentially sees itself as thriving. Probably both from the perspective of cultivating your talent and keeping your talent as part of that puzzle. I'm wondering how you think the not-for-profit human services sector has or hasn't done in thinking about themselves as a business, and part of that job of a business is to cultivating and develop that talent.
Yeah, I think we, I believe it's a lot harder to run a nonprofit than a for-profit. We just don't have the resources. And I think we do our best in trying to find trainings, free trainings, be part of coalitions like NYCETC so that we can have shared thinking. But ultimately we just need resources. And so if there was a way to do this in a way that allows organizations to share resources, knowledge, that would be amazing. I do think, actually, I know many organizations invest in training, whether it's supervision, whether it's, free trainings, outside trainings, developing a training department. But this is something different. This is providing career paths. I mean, by the way, we each of these 14 staff members are required to stay at the door for an additional 2 years. So it is an investment. But after that, when I got my MSW degree, I realized I can do almost anything I wanted. And so providing that to 14 people is so amazing. And the idea that this might happen larger scale, and to that point, the door is looking at securing funding for more of these types of program, more cohorts, so that we can work with other organizations and allow other organizations to be part of this. So you might not have an organization large enough, or you might not have the knowledge about how to create this, but if we can create a pathway where organizations can send 1 or 2 people to this cohort, would love for that to happen as well. And when we mentioned this to some funders, they thought this would be a great idea as well.
Yeah, I appreciate you sharing that. I was getting to this place of, this is fantastic for the door. As someone who's had history with the door, I know that there is opportunity, there's resourcing, there's relationships, there's, and then you think about organizations. Every organization has gifts, every organization has challenges, every organization has complexities, and start to think about how it is that someone who may be on this call or maybe listens to this recording later on says, I want to do this where I am, how can I make this possible? Then the question becomes, well, how do you resource? So it's really encouraging to hear of your interest. And it's encouraging, by the way, to hear of philanthropy and higher ed's interest as well in having the branches kind of extend out here a little bit so that other folks can participate. That's a pathway to scale, quite frankly.
Absolutely.
I guess the other thought, the other thought I had, I also appreciate you flagging for us that, because I was curious what the commitment was. You talked a little bit about the financial commitment, their scholarships though, but then you're also talking about a 2-year commitment post this point. So the question then becomes, where is it that you see these folks? So 2 years they're with you, and that's presumably they're with you, but then the question then becomes, where do you see their careers evolving to? And as you said, they can take on lots of other opportunities from here. Do you think folks will stick around, or are they going to find their pathways to other places?
Yeah, I hope that they stay at the Door and Broome Street Academy. Of the 14 students, we have teachers, managers, administrators, frontline workers, a variety of people from all over the organization. The organization has a responsibility to provide. So once they get their degree, we need to do our part in making sure there's an opportunity for them to use their degree and to earn more money. Like let's be real, right? Like, so ideally we can do that for everybody. And of course we have a year and a half left to plan, to plan for it. And hopefully they will continue to grow at the door and BSA. Promotions, more work. I mean, not more work, like overload them, maybe other opportunities. But if not here, then somewhere else. I mean, because this idea, like, of course we want the door to benefit, but this is also really kind of a field issue. Like the field of social work and youth mental health and other nonprofit sectors, and that the door takes that rather seriously, our contribution to the work writ large, not just our universe of people, because, whether it's New York City, New York State, whatever, we need to make this a better place. And so that's what we're interested in doing.
We'll take one more question here for you in this, and then we'll pivot to in the chat, questions in the chat or open questions we can dig into. I definitely want to give Yanira an opportunity to say a few words. I think Yanira is going to share a little bit about an opportunity that's available. We'll open up the chat to do that in a second too. But before we do that, Kelsey, I can't help but celebrate the work that's happening. So enthusiastic about this cohort. Looking forward to hearing about how it is that the graduates here, the students here, that ultimately your graduates and the next cohort grows, that the connectivity to other organizations and trying to bring them on board, philanthropy's investment, NYU's investment. It's very exciting. That said, we know we are living in a very complicated moment in our history, both our city's history, our state's history, our nation's history. I think based on what I've seen online and other postings, the Door team is, I think, what it seems to me, doing what it can to communicate that this is a challenging moment for individuals that you work with. I'm just wondering how it is that you are taking care of yourself, how the staff is taking care of itself, how it is that you're supporting and encouraging and keeping your young people on track, encouraged as we kind of go through what is in so many ways unfathomable to hear and learn about how it is that in particular, our federal government right now is treating, I think, individuals or thinking about treating individuals that I know you have an interest in serving and supporting and have history doing so.
Absolutely. Thank you. I mean, we can spend 4 hours on this topic, but I'm going to try to summarize. One, I think it's important to understand that everyone copes with this type of situation differently. And we all need to start acting with more grace than before. Hopefully you're acting with grace, but more grace, because people will react differently. People, it'll come out in different ways, not just only in conversations around this, but it comes out in all ways. Our ability to focus, our reaction to other news about other stuff. And so that's one. Two, I think it's understanding what we can do and then doing that. So for example, focusing on things like know your rights, because that's something that's concrete we can do, and we can disseminate information. And while there are reasons to be fearful, how do we think about fear strategically? There are many people who are using fear as a weapon. How do we not allow that, but at the same time acknowledge that there are some legitimate reasons to be fearful, and what can we do to minimize that? And just saying that we are going to continue to fight for what's right, and to fight for the services for our young people, and we will do this together. And what I'm hoping that comes out of this is a resurgence of nonprofits working together, and leaning on one another for support, to develop tools, strategies, and share resources.
Well, thank you for that, Kelsey. Much appreciated. We're going to open it up the channels here. If folks have questions, and like I said, I want to make sure Yanira gets an opportunity to talk a little bit about program component that I think 1199 wants to put forward. Before we do that, I know in the chat, I did see a couple of notes. Folks appreciating this initiative. Great to see personal case stories. I love folks networking in the chat section, by the way. That's great. If you have questions, feel free to plug them in. I see a notation about what do you think of a social work bill associated with removing a licensing exam or something along those lines. I have not looked at that bill. I'm not sure, Kelsey, if that's something you're familiar with. It's in the chat. Maybe something to take a look at when we have some time, unless folks want to jump in and say a few words about that now. And I also see in the chat, great to hear about the work. Why not CUNY? Look at that, CUNY being, as someone who graduated from NYU and CUNY, I like to see all these entities stepping up in all the ways that they have. At this note, anybody participating want to jump in with a question either in the chat or online through this particular Zoom? Feel free. Give it a second. All right. On that note, Yanira, do you want to jump in and share a little bit about your training and employment options? This is Yanira from Community Engagement, 1199 Training and Employment Funds. I know there's a model you want to share. Go ahead.
Yes, good afternoon, everyone. Kelsey, first of all, it has been so inspiring. We often go to different workshops and orientations and meetings, but this has been so inspiring. So, kudos to the work that you're doing. So Yanira Camilla, Community Engagement at 1199, the Training and Employment Funds. And so we have received a grant that is allowing us to provide scholarships to individuals to the Career Pathway Training Program. And so the state has identified 13 occupations to be targeted, but I want to highlight 2 that are relevant to this conversation: the Masters of Social Work and Licensed Mental Health Counselor. And we had this unique opportunity and funds through the Career Pathway Training Program to provide extensive support through 500 MSW scholarships and 300 LMHC scholarships for individuals who will work at Medicaid enrolled employers. So I put my information, it's the presentation that we often do is a little bit extensive. So I put my information in the chat. So if you want to hear more about the Career Pathway Training Program, what we're doing right now to recruit participants that are interested in the Master of Social Work and Licensed Mental Health Care Worker, please feel free to reach out to me. I also included the website so that you can also take a look at it. And again, feel free to reach out and let us know if you want us to do a presentation to your staff, to your staff, and to your participants.
I so appreciate you sharing that information. NYCETC will, I think we already got the thumbs up, we'll share that content with our network so people can get in contact with you directly, Yanira, and then ETC will put the word out as well to our membership to let them know where they can find additional information about what it is that this particular opportunity that's available through training and education funds. I think that's a great opportunity for folks, and I appreciate you teeing it up here for us during the course of this conversation.
Thank you so much. And just to know, so that you know, this is not only for 1199 members, this is open to the public. So whoever
Beautiful.
wants to do this, they can enroll and be part of it.
And that's what everybody wants to hear, because the first question was, well, do I have to be in this path? Oh no, it's open to, much the same way with Kelsey saying, listen, this is related to the door, but we're going to open up these doors related to this opportunity. There's the collaboration and partnership that probably matters more than ever to providers in this particular human services space, social service providers, healthcare providers, anyone who's in service to others. Collaboration probably means more than ever before. Some great content in the chat with some networking. Kelsey, I'll turn it to you at this point. Is there anything we didn't cover, any other pieces of the puzzle, anything new and exciting happening at the door or otherwise that you want to share with us before we wrap up?
Yeah, there are 2 things. Thank you for that opportunity. There are 2 things. One is, although, we focus on this particular program, which helps staff get their MSW, I do think this model of creating a pathway and pipelines should be replicated in all types of field and at different levels, not just the master's degree. So that's one, and because I think that's really important. Similarly, when we think about mental health work, I think it's also important to note that not everyone needs to get an MSW. That we should really also focus on building out the other ways to support our youth who may not want to or need to speak to a therapist or a social worker, and to invest in other strategies where things like mental health or psychological first aid, or creating the pathway and to build the skills of staff to be able to identify when greater mental health care is needed. I think that's really important. Also, as a social worker, I feel like I get to say that the field of social work sometimes gets it wrong. We often, focus on deficits. We diagnose and then we try to fix a problem. And at the same time, we wait for a mental health crisis to happen and then we intervene. I think the field really needs to think about doing things differently, in particular, focusing on our young people's strengths and resilience. Because we know that at the door, when we see a young person's strength, they see their strengths. And when they see their strengths, they can achieve their dreams and goals. And also doing more preventative work so that we can prevent the onset of a mental health crisis. And then finally, in this idea of being able to support the community, on September 25th, Gabby, correct me if I'm wrong, the Door will be hosting a conference focusing on youth. There will be a specialty in mental health, but it'll be in New York City this year. And I'm hoping that this will be, within 5 years, the largest conference in the country on youth development, where conversations like this, conversations, Greg, that you facilitate through NYCETC every day, can continue to happen, and where we can share best practices, share resources, share ideas, and be in community. So I just wanted to say those few things.
I know you are well on your way. Save the date, September 25th. Everybody who's on, takeaways here, I think it's always important. What do we take away? What do we do next? The idea of collaboration and partnership has never mattered more. The desire to create the actual scaffolding that connects someone, whether they have a degree or a credential, to the next degree or credential, matters. To resource that so that they can see their potential grow over the course of time, to make more money, that communities, institutions, agencies are focusing on cultural competency is meaningful, despite every commentary that's been made from the federal level on the absence of care and concern, or the harm that comes from thinking about diversity, equity, and inclusion. The exact opposite is true. People statistically and rationally do better when they are feeling like they are part of a solution. It helps us dig into the problems, as you also said, dig into problems in new and different ways. We do better when we are working collaboratively and successfully, even if that's hard work. I do want to just reinforce that idea of thank you for seeking and commenting on how it is that both for professionals as well as for our young people, how we connect the dots so we see growth over time really does matter. And taking that on in different sectors and different job occupational strategies and different lanes could be hugely transformative in a lot of our lives. As an entity that's focused on the workforce, that is a key piece of how it is that we can all be doing better. Last but not least, I can't help but say it. I was lucky enough again to work at the Door for a number of years, and I both for the people that I worked with and the young people that I was able to just be part of their journey. In the eyes of many, people could only see the deficits and vulnerabilities, and I would just suggest the opposite was true. There was nothing but resilience and power, and that's exactly what we need to draw from if we're all going to do better, is draw from each other's strength, our power, and our connectivity. On that note, Kelsey, I can't thank you enough. There's some fantastic conversations in the chat. We'll leave it open a little longer as people share their contact information and make connections online. Yanira, thank you so much for teeing us up. The coalition will continue to share that information. And if you haven't put September 25th on your calendar, you better, because I know it's just one step in the scaffold that the Door is creating for that biggest conference ever, biggest conference across the country, in the globe for young people. That's what's next. On that note, thanks everybody for this time. Kelsey, thank you so much. Door team, you are all
Thank you so
fabulous.
much.